Hey, I'm Dr. Alara Hayes, and today we're going to talk about something so ordinary, so personal, and so constant in so many women's lives that it often gets pushed into the background, even though it shapes your comfort, your confidence, your health, and the planet. If you have ever stood in a bathroom holding a tampon, a pad, a stained pair of underwear, or a wave of frustration in your chest and thought there has to be a better way to do this, I want you to know that you are not being dramatic, you are not being difficult, and you are not alone. Over a lifetime of menstruation, many women use thousands of disposable period products. And when you really stop and picture that, the wrappers, applicators, pads, and waste, it can feel overwhelming. But this is not about shame. It is not about blaming you for what you use. It is about giving you real choices, safe, practical choices, and helping you understand which options may fit your body and your life. I have sat with teenage patients who felt embarrassed because they did not even know there were alternatives. I have cared for mothers trying to get through life, cramps, and heavy bleeding without one more thing to manage. I have spoken with women who told me no one had ever explained menstrual products to them beyond adolescence. And I have met women who carried guilt because they wanted to make more sustainable choices but felt intimidated by anything unfamiliar. And once you understand your options, shame loosens, fear softens, and choice finally starts to feel real again. You do not need to be perfect to care. You do not need to change everything overnight. You just deserve honest education. One of the simplest alternatives is a biodegradable tampon with a cardboard applicator. This is often the easiest first step for someone who wants something familiar. It works like the tampons you already know, but it reduces plastic use. For many women, that small shift matters because sometimes the first sustainable choice is not the most dramatic one. It is simply the one you can realistically live with. If you like the feeling of an applicator and you want the least intimidating transition, this can be a gentle place to start. Another option, and one that many women are never taught about, is the applicator-free tampon. I remember a patient in clinic laughing nervously and telling me she thought these were only for people who somehow knew more about their bodies than she did. What she really meant was that no one had taught her to be comfortable with her anatomy, and that truth broke my heart, because you should not have to feel like a stranger to your own body. Applicator-free tampons are compact, often less expensive, and create less waste. You insert them with a clean finger, placing the tampon gently into the vagina until it sits comfortably. That is all. There can be a learning curve, yes, but not because your body is complicated or wrong. Usually it is because no one ever gave you calm, respectful guidance. There are also reusable tampon applicators for women who prefer the insertion style of an applicator without throwing plastic away each month. For some patients, this becomes a practical middle ground. It is washable, reusable, and helpful if the idea of changing your routine feels like too much all at once. And that matters because real change often happens in steps, not leaps. Now I want to talk about menstrual discs, because these are the products that often spark curiosity and fear at the same time. A menstrual disc sits inside the vagina and collects blood near the cervix. Disposable versions exist, and some women find that because a disc can be worn for longer stretches than a tampon, it reduces the number of products they use overall. It is still plastic, so it may not be the most eco-friendly option on the list, but for some women, it feels more comfortable or manageable. There are also reusable silicone discs, and those can be a very appealing choice for women who want to significantly reduce waste. What is especially important for you to know is that menstrual discs are a little different from menstrual cups. I have had many patients confuse the two because the way they sit in the body is not the same. A reusable disc does not rely on the same kind of suction around the cervix that a menstrual cup does. That can be especially relevant if you have an IUD. If you use a menstrual cup and an IUD together, there may be a slightly increased risk of dislodging the IUD, especially if the cup is not removed carefully and the suction is not broken first. It simply means you deserve to know the risk so you can make an informed decision. For some women with an IUD, a disc may feel like a better fit. And then there are menstrual cups. Some women love, others try them once, feel confused, and toss them into a drawer for 6 months before trying again. Both experiences are normal. A menstrual cup is usually made of medical-grade silicone. It folds, goes into the vagina, opens, and collects blood rather than absorbing it. That means less waste, lower cost, and for many women, fewer product changes throughout the day. There is often a learning curve. You may have leaks the first few cycles. You may need to try more than one shape or size. That does not mean your body failed. It means you are learning. I remember a resident physician I worked with who came to me and said she wanted to love her menstrual cup because everyone told her it was life-changing, but all she felt was defeated. We talked through placement, pelvic floor tension, fit, and patience. A few months later, she told me it had become the product that made her feel free during long hospital days. That is the part people do not always say out loud. Sometimes freedom comes after practice. Sometimes confidence is built, not instantly felt. Reusable cloth pads can be an excellent option, especially if you have sensitive skin. Some disposable pads contain materials or fragrances that irritate the vulva, and when your skin is already irritated, that can feel miserable. Reusable pads tend to be softer, and many women find them gentler. You secure them to your underwear, rinse them after use, and wash them without fabric softener. Are they still a beautiful, practical solution for many women? Absolutely. I think of one patient who had been suffering with repeated vulvar irritation and thought she was somehow doing feminine hygiene wrong. She whispered through tears that she felt dirty all the time. After a careful conversation, we realized her skin was reacting badly to the products she had been using for years. Switching to softer, reusable options did not just help her skin, it changed how she felt about herself. That is why this conversation matters. Sometimes the right period product does more than catch blood. Sometimes it returns dignity. Period underwear is another option I genuinely appreciate, especially for overnight use, lighter days, backup protection, or those uncertain hours before your period begins. Good period underwear has an absorbent built-in lining and can hold the equivalent of multiple tampons depending on the style. For many women, it brings relief. Relief from leaks, panic, and the fear of staining clothes, sheets, scrubs, school uniforms, or the seat beneath you. And if you have ever structured your life around that fear, you know how heavy it can be. I have seen that fear in exam rooms. I have heard women joke about it with a smile while their eyes filled with embarrassment. I have watched young girls clutch a sweater around their waist because they were terrified someone had noticed. That fear is real. So when I tell you that period underwear can be life-changing for some people, I do not mean trendy. I mean emotionally life-changing. I mean the kind of relief that lets you breathe. Sometimes the hardest part is not choosing a product. It is facing the private anxiety that comes with trying something new in a body you have been taught to manage silently. I have had patients sit on the exam table and ask me in a whisper, "What if I cannot get it out? What if it leaks at work? What if I do everything wrong?" And what I tell them is this: fear does not mean you are weak. It means no one gave you enough support. Most period products have a learning period, and most women judge themselves far too harshly in that first attempt. If you try a disc and it feels awkward, if a cup leaks, if period underwear feels unfamiliar, that moment is not failure. It is information. Your body is teaching you what works, what does not, and what deserves another chance with gentleness. Now I need to speak very plainly about one product I do not recommend: sea sponges used as menstrual products. I know they are sometimes marketed as natural, and natural can sound comforting, but natural is not automatically safe. In medicine, we have to ask harder questions. Can it be cleaned reliably? Do we have good safety data? What bacteria can it hold? Sponges can harbor bacteria, including bacteria associated with toxic shock syndrome, and they can be difficult to sanitize completely. They may also tear, become difficult to remove. I have treated women with vaginal irritation, retained foreign material, and infections that began with products they assumed were harmless because they were sold as gentle or natural. So please hear me when there are safer, better studied alternatives available. This is not a risk worth taking. And underneath all of this, there is a deeper truth I do not want you to miss. You are allowed to want comfort. You are allowed to care about waste and cost. You are allowed to say, I want something better for my body. You are allowed to try a cup and hate it, try period underwear and love it, use different products on different days. There is no moral prize for suffering through a product that does not work for you. What I want for you is knowledge. Your period is not a personal failure or a secret that should keep you disconnected from your body. A sustainable choice does not have to be a miserable one. I want you to feel curious instead of ashamed, informed instead of confused, and supported instead of alone. Because after all my years in gynecology, after all the hospital rounds, clinic visits, and brave questions, one truth returns again and again. When women are given clear, compassionate information, they make powerful decisions. They start listening to their bodies. They realize they deserve options. And when that happens, something shifts. Fear softens, confidence grows. The body stops feeling like a battleground and starts feeling like home. So if you have been silently wondering whether there is a safer, smarter, more sustainable way to manage your period, This is me telling you, yes, there may be. Start where you are. Ask questions. Be patient with yourself. Choose what feels safe and realistic. And please never confuse familiarity with superiority. The product you grew up with may not care for you best now. You deserve menstrual care that respects your body, your health, your future, and your peace of mind. You deserve facts without judgment and honesty without fear. And above all, you deserve to know that what you experience in private is worthy of public compassion, medical attention, and real solutions. You are not asking for too much by wanting better. You are finally asking for what should have been yours all along. The period products that protect you and the planet